Staying in Lebanon, the UN is warning that a humanitarian catastrophe is looming with a quarter of the population in need of aid. The UN Office for Humanitarian Affairs has doubled its aid appeal for Lebanon. It says nearly $640 million is needed to address a worsening humanitarian crisis. Lebanon says Israeli attacks have killed more than 3,500 people and injured more than 10,000 others since the attacks began in March. Nearly 1 million people have fled their homes, while more than 1.2 million are facing food shortages. The cost of water, fuel and electricity is up by more than a third and as high as 70% in the conflict-affected areas. And Lebanon's healthcare system is also affected, with 62 hospitals and other health facilities either damaged or closed. Well, for more, we're joined now by Dr. Caline Rehayem, who is a medical coordinator for Doctors Without Borders in Beirut. She joins us from the Lebanese capital. Thanks so much for being with us. First of all, can you just talk to us about the scale of the issue here, because that seems to be the biggest problem at this point in time, and a huge shortfall in funding to deal with it.
Thank you. In Lebanon, but specifically in Beirut and the southern suburb of Beirut, communities are facing critical gaps in access to healthcare and other essential services such as safe water. Dahya, for example, that is a densely populated and highly vulnerable southern suburb of Beirut, has been suffering from damage due to repeated indiscriminate airstrikes. Thousands of families have been forced to flee due to displacement that is secondary to the forced movement or repeated displacement orders. As a result, MSF has upscaled in response to these exacerbated needs our activities, including mobile clinics or mobile medical units. 9 are present in this area and responding to the needs by providing essential medical care, such as medical consultations for acute and chronic conditions, sexual and reproductive health, and mental health and psychosocial support.
Right.
We see children, elderly patients and pregnant women who are in critical need to access healthcare.
As we heard from our correspondent, that many of these people have been displaced multiple times. Some of them have been out of their homes, their communities for several years now. What is the long-term plan for those people? And I guess your organisation is designed to deal with the immediate, but how much care can you give them in the long term?
We have concerns about the deep and long-term impact of the current crisis on the civilians and the impact on the infrastructure, the destructions and impact on the infrastructure in terms of healthcare facilities, whether primary healthcare or hospitals, but also the destruction affecting roads, water infrastructure, and as I mentioned, the repeated displacement orders that force people to flee multiple times seeking a safer place. This hinders the possibility of safe return to their homes, and has also forced them to be living in precarious conditions.
The UN says that nearly $640 million in aid is needed to address what they're saying is a looming humanitarian catastrophe. How concerned are you about where that money is going to come from?
On the ground, we see vulnerable patients that are struggling or having challenges in order to access essential needs, as I mentioned, such as safe water or healthcare services. As MSF, we are also supporting damaged primary healthcare centers in terms of rehabilitation, but also in coordination with local authorities and municipalities, supporting the rehabilitation of water infrastructure in order to secure access of the communities to these essential services and contribute to preventing healthcare risks, including outbreaks.
Thank you so much for joining us, Doctor. We really do appreciate it. That is Dr. Caline Rehayem with Doctors Without Borders for us from Beirut.